do you know if you are infected with COVID-19? The first cases of the 2019 novel coronavirus were reported to health authorities in Wuhan in China's Hubei province in early December. Now, nearly 3 months later, the outbreak has spread to 33 countries around the world, including South Korea, Japan, Thailand, Iran, Italy, the UK, the US, Brazil, etc. Up to February 27th, the number of the total confirmed cases outside of China has reached nearly 4,000. First of all, we are concerned, but we shouldn't panic. And we need to look at it rationally, especially when you think you might have it. So how do you know if you are infected with COVID-19? In the early stage of the outbreak, organization experts such as WHO said symptoms may include fever, cough, shortness of breath, breathing difficulties, headaches, and chest pain. But as the virus progressed, medical staff found out that there were confirmed cases that didn't have any respiratory symptoms, but rather gastrointestinal symptoms such as vomiting and diarrhea. And just recently, scientists have discovered that the virus exists in excrement as well. If you have any of the symptoms I mentioned before, you should go to the hospital and get yourself checked for the coronavirus immediately. When you go to the hospital, wear your mask and do not take public transport. Don't just stay at home and think, oh, I should be all right in a few days because you want to avoid cross-infections. If you take enough precautions, then you will be fine. One more thing that kind of freaked people out was that health authorities have said one can spread the virus and not know it because this person may not be showing symptoms. This is because he or she may have had contact with someone who, for example, recently returned from Wuhan or an epidemic area and got infected. But the person's immune stress response isn't as strong, or he or she is still in that incubation period, during which you can still transmit the virus to others. This is why we emphasize the importance of wearing masks over and over again. So the next time you hear the argument that masks are useless if you aren't sick, you know it's wrong. However, don't overreact and assume those symptoms mean you have the coronavirus. We've all done that thing where you have a headache and you look it up on Google, then you end up thinking you have brain cancer. What? So monitoring is necessary, but panicking doesn't help. Keeping an even keel is also important in this case. The placebo effect can work like magic at times. If you are healthy, you should avoid big gatherings. I understand you want to meet your friends and have a couple of pints on a weekend, but it can wait. For the sake of everyone's health and our lives, just stay at home. When you do have to get out of your apartment, and you should always remember to wear masks, unless you will be in an open area with just few people around. You should also learn to disinfect properly. For example, which type of fluids kill the coronavirus and which don't, what percentage of ethanol is the best, what to do and not to do when using certain disinfectants. Keep yourself updated and pay attention to any information your local Center for Disease Control and Prevention provides. That's it for today, and stay tuned for more coronavirus surviving tips by subscribing CGTN. I'm Ning, I'll see you next time.